Hi, welcome to Take 5 with 5 Elements. Today I'm going to take up some questions from some of the patients who have recovered from COVID. The first question being, when will I feel better and good enough as I was before I had COVID? So answer to that question is that it really depends and it varies from individual to individual. Some people feel good to go within first 2 3 weeks, after I would say second week, and they in the third week they would feel little weakness, but they feel like themselves. Some people don't feel good even after 2 to 3 months, and some people even take about 6 months to feel the same as they were before COVID. But still, I have even met some of the patients who had COVID about 8 9 months back, and they still feel that there is some brain fog, or they get anxiety very soon, or they still have some kind of weakness, or they are losing hair. So you would never know. But to kind of provide a solution to certain things like this, I would say it's very important that you supplement your diet pretty well. Investigate, get your blood test done and see if you are deficient in any of the minerals or vitamins, because what happens is sometimes we would not think that we would just think it's COVID, but there's something else going on with some other health related issue. So it's very important you discuss with your primary care doctor or your doctor, and get your blood test done so that you have a fair idea of what's going on. Another thing to be careful about is what kind of supplements are you taking. A lot of patients tell me that they are taking supplements, but their supplements are not very easily absorbed by the body. In case that happens, you would be absorbing only 20-30% of the content, and you would think that you are taking that mineral or vitamin, but you will still be deficient. Another important thing to be careful about is that look at the absorption. Try to read more about what vitamins should be taken with what food combination so that they are easily absorbed. Like I always suggest my patients to take their iron supplement with their major meal so that it's easily absorbable. A lot of patients would complain if they take iron supplements on empty stomach. It causes them a lot of kind of disturbance. They don't feel, it's not agreeable actually to the body. So post COVID, you could still continue to take your vitamin B and vitamin C. As I always recommend during COVID also, or any kind of health issue, it's important that you take your vitamin B and C supplementation appropriately, because these two vitamins can be washed off from the body. If they are more, your body will not hold them. They will be flushed out of the body. Just make sure you take enough water. And vitamin C, actually, all of you know that goes a long way towards supporting your immunity and cleaning your system. So it's important that you always make sure, whether you have any health issue or not, you do make sure that you have sufficient B and C in your body. Next comes vitamin D. Most of the times post winter, people would get vitamin D deficiency. That defines a lot of weakness. Generally, most of the people after winters are complaining that they feel weak. So as you would get your blood test done for all these once, I would say at least twice a year, after 6 months, you would get a fair idea of what's going on in your body. Also make sure any kind of difference, and I would say, let's say if you are feeling any kind of weakness that goes on for more than 2 weeks, you should definitely discuss with your doctor. Try to take fresh fruits and vegetables. Once you recover from COVID, you can add more fruits and more vegetables. During COVID, it is advisable that you take light food. If possible, avoid sweets altogether. I do understand there is loss of taste and smell, and sometimes some people get bitter taste and they would want to take sweet food, but any kind of sweet is only messing up with the cell membrane, which makes it harder for the vitamins to be absorbed and used properly in the body. So it's important that you avoid sweets so that other supplements that you are taking can work better. Also, magnesium and zinc are very important during COVID. A lot of people are stressing the importance. You can easily have these from, I would say, keep taking eggs regularly. Also, don't miss proteins during your recovery period. Also, when you are not well, even if you are consuming less, but still at least your needs, little bit of your needs are being taken care of. Try to take a lot of fluids, if possible, citrus, a little bit of lemon juice with black pepper, honey really helps. It's also very important that you take out a little time to exercise and meditate. It's very important that you maintain a healthy mental balance. I know it's really, really hard. I have been through it, and that's one of the biggest challenges. But once, if you are able to kind of take time for meditation or set a regime and schedule and do that as a discipline, it actually helps you a lot. It honestly works on your systems. You have on seen how breathing exercises can bring up the oxygen saturation level, how lying prone on your abdomen helps to bring up your oxygen saturation levels. So I would say try to do it as a regime. Try to just, because once you start doing it, you will see how important and how beneficial it is. Try not to lie down all the time on your back, because that's where your lungs are taking all the pressure. They don't get time and they don't recover soon. So it's important that you keep moving as and when you can, or at least don't lie down on your back all the time. Try to lie prone on your sides, do some exercise and keep moving. Always remember, everything starts in your head. So once you try to do all these things, and believe me, you can, everybody can, but it's you and actually only you who can do it. So all the best and be well.